Got a brain full of questions about dental implants?
Actually, surgery is just 1 day or 2 days, but we want to check everything before you leave.
We visited one of Istanbul's award-winning clinics to get all your answers.
What about the patient only feel the needle? After needle, all numb, you cannot feel anything. My name is Madina. I'm prosthodontist who was graduated in Azerbaijan first, and my first degree from Azerbaijan, I finished dentistry there. And then I moved to Turkey, to Ankara, to do my specialty and PhD. After PhD, I directly moved to UK, to London, to see the practice as well. So I've been to university there, Queen Mary University and King's College, to just recognize, that just what they are doing, just see their practice as well. And after 2 years, I moved to Istanbul again. I finished my PhD and specialty in Ankara. I was working there 5 years. So I have several students, which is they finished, now they are dentists. And after Ankara, yes, I start working in the different clinics. And then more than 5 years, yes, I'm working here.
Hello, I'm Dr. Eda Nayfoğlu. I'm an oral and maxillofacial surgeon. In 2012, I graduated from Başkent University, and after that, I got my PhD degree in 2018 from Ankara University. And after that, I started working my practice in Istanbul, and now I'm also an assistant professor. In 2012, I graduated from dentistry faculty, and after that, I started my PhD degree in Ankara University in 2000. Since 2012, I only perform oral and maxillofacial surgeries. Dental implant is a titanium material that mimics the tooth root. We place it inside the jawbone, and it will be like acting the root in the feature when we do the prosthesis on it.
So if patient losing one teeth, we can do the bridge or we can do the implant. Especially when in young age, we need the bone, good quality bone. And to make that bone, the bones support the implant. So when the enough bone and the quality bone, we are doing implant. And when we are doing implant, for example, for one teeth, we are doing one implant, of course. But more than one teeth, patient do them, for example, how many teeth needed. We are doing the plan for that one. Not every teeth we need one implant. Sometimes we are putting the gap between implants and doing the, for example, 2 implant, 4 teeth or 3 teeth.
There are also some different type of protocols of implants. We call them all-on-4, all-on-6.
Patient doesn't have any teeth and good quality of the, then we are doing the upper jaw 8 implant, lower jaw 6 implant, doing the implant supporting zirconium. When patient doesn't have good quality bond, lost a lot of bond, and when we are doing the crown is going to be big. Then we are doing the 6 implant upper, 6 implant lower, or 4.
So out of all the dental implants procedures, do you have a favorite?
Actually, I think zygomatic implants are my favorites because it was also my PhD thesis, so I've been working on them for a long time. And I like to give the patient a solution because zygomatic implant patients has no alternative. For the patients who has severe bone loss, especially in the upper jaw, we can perform zygomatic implants, which is a specific type of implant. We choose this protocol, one of these treatments, according to the patient's bone loss, actually, and the situation and their systemic diseases. We decide the protocol and discuss it with the patients.
This patient especially coming for after 45 or 50 years old, which is they lost their teeth very early age, and then they use movable prostheses. So when patients use movable prostheses, they don't have enough bond. because when they're moving, the denture moving, they are losing bone. So they don't have a chance to do any implant. Then we are doing the zygomatic implants. So basically, what does it mean, zygomatic implants? We are taking support from the zygoma and putting implant there. And this implant, when we are doing this implant, generally we are doing this fixed dentures to the patient. A zygomatic implant, the surgery doing general anesthetic or sedation, depends how many zygomatic implants they are going to do. For example, sometimes front area we have a bone, the back area completely no bone, so we are doing the zygomatic implant. Front area we are going to normal implant.
So who's a good candidate for all-on-4? And then who's a good candidate for all-on-6? So maybe you could just mention the eligibility.
All-on-4 protocol is invented for the patients who had bone loss in the backside, actually, both upper and lower jaw. If the patient has good bone quality in the front area, like this area, but in the backside, severe bone loss, we can't fix with some bone grafting, then we decide to do the all-on-4. All-on-6 is a little bit different. In that case, we place implants to the backside as well. We don't tilt the implants, but sometimes it can be tilted as well. We decided when we do the different type of prosthesis, the patient has vertically bone loss. When we choose that prosthesis, then we can go for all-on-6. Zygomatic implant are anchored to the zygoma, which is actually the cheekbone. We do this implant to the patient who has very severe bone loss in the upper jaw. It's not an alternative for the dental implants, actually. It's a solution for the patients who has very severe bone loss.
Now, there are two occurs if they have bone loss in upper jaw. One is bone graft and standard implants, or zygomatic. Which one do you think has higher success rate in worry?
Bone grafting is a successful solution when the patient has horizontally bone loss. So we can make it wider and we can place wider implants. Vertically, also we can do some bone grafting, but we have limitations, which is a good solution to create the anatomy like it was before the bone loss. Actually, bone grafting is of course better to have the old anatomy you have, but it has limitations. We have to harvest the bone from the patient's own body because we call it autogenous bone. Your own bone is the golden standard, but sometimes we're not able to harvest enough bone. And also in the healing period, when we place the graft there and waiting for the healing, it is minimum 6 months. Patients can't use any dentures. Nothing removable, no pressure. So it will be empty, the area. After 6 months, we place the dental implants and we wait 3 more months. So it has a very long waiting period. If the grafting area is not so wide for like 3 teeth area, so it's better to do the grafting because zygomatic implant is a final solution, I think. After that, you don't have a choice to do the bone grafting. But when you have the bone grafting, after years, if you have any problems, then you can also go for the zygomatic implants.
So even if they consider not getting bone graft, they need a quicker solution, they can opt to go for zygomatic right there.
Yes, zygomatic implant is a very quick solution, and also it is reliable because the cheekbone, the zygomatic bone, is a very strong bone. We sometimes in the same session we can use fixed dentures on zygomatic implants. They won't be zirconium, a softer material, but they will be fixed. So it's a very good advantage for the patient.
So is that something you figure out once the patient comes here? Or do you know beforehand that this patient might need a bone graft or, a zygomatic implant?
If we saw the X-ray, especially 3D X-ray, shows us almost everything. So we can decide before the patient comes. But sometimes in the dental chair, we see something different than the X-ray. On the X-ray, the bone looks good, but on the dental chair, we see that it's infected. So we don't have enough place to put the implant, or it's not possible to put the implants. Or the patient's systemic diseases are very important to decide the implant type. So mostly we can decide before the patient comes here if we have the 3D X-ray, but sometimes things can change on the dental chair.
When patients already have submitted their CBCT scans, when they arrive at the clinic, do they have to go through one at the clinic to make sure you understand the current situation?
If the patient has recently taken CBCT X-ray, we can open it our system, we can check it. Then we don't need to take a new one. It's not correct actually as well. But if you don't have, the first step is taking the X-rays. When the patient arrives in our clinic before the examination, we get the X-rays as well. And after that, with a prosthetic doctor and oral maxillofacial surgeon, we do the examination together. And then we decide the things that together, because sometimes we have limitations and we consult with each other. For the teeth that we can save it or not, we also consult to the endodontist for the situation. And also we have periodontologists. We consult if the patient needs a periodontal treatment. Then we make the whole plan, give the plan to the patient, and then we discuss it with the patient, of course, if it is suitable for him or not.
So, what documents do you require beforehand?
Panoramic X-ray is a very important step for the planning, but sometimes it's not enough to see all 3D things. So if we can have the CBCT, of course it's much more better, but it's not a must actually. And about the systemic problems, the health problems, if the patient has a blood test or any different tests according to their diseases, it should be quite recently had. It's good to know the blood sugar, like if the patient has diabetes, or about the things like hypertension, all the tests. If the patient has it, then you don't lose time in clinic.
What is the treatment plan? For example, I'm an international patient and I'm coming in for dental implants or for. Is it the same for all type of implants, or is there a difference in how many days it takes?
We start with the examination, of course. We have a pre-plan actually, but in the clinic sometimes we plan something different. So when we do the plan, there are some treatments that we have to do before surgery. So we want to do the surgery actually as soon as we can, so we can do the follow-ups before the patient leaves. But mostly in the first day or the second day, we place the implants. After we place the dental implants, we want a healing period before we load the zirconiums on the implants. So in your first visit, we will plan the surgery, of course. Actually, surgery is just 1 day or 2 days, but we want to check everything before you leave, so it's better to see you around a week in Istanbul. And after that, you can leave with your temporary teeth as well. They won't be like zirconium, but they will help for the function and aesthetic meanwhile. Mostly 3 months or sometimes 6 months later, we want you to come back for a second visit, and in that visit we do the fixed dentures, zirconiums on the implants.
So after 1 day we are taking impression. This impression is digital impression. In 2 days we are making the fixed dentures. So this part is my part, which is prosto part. So I'm doing the taking impression. It's the extraoral impression. It's just with camera we are taking impression, and then we are intraoral. We are taking again scanning that area and doing the fixed denture. In second or third day, we are fixing denture to the outpatient mouth, and the healing process is going with that denture, fixed denture. It's good because the gum is healing like that and it looks very natural look. And after 3-4 months, patient coming and we are changing that teeth. Again, procedure is same procedure. We are taking digital impressions and sending to the lab, and they are making new teeth.
The first visit is not always the best one because we do surgeries, we do the root canal treatment, so it's the hard one. But the visit that you have your crowns is the best part. I do the surgery, so I'm on the bad part actually. But after they have the crowns, the treatment is finished, the patient gets really happy, especially if they're not happy with their smile or they didn't have teeth for a long time. It's a very, like a miracle moment for the patient, because when the prosthodontist puts the crown and the doctor thinks it's okay, we give the mirror to the patient and they see they smile after a real long time. It's a very good moment, and it's the thing that we do this job for that. I'm on the best side, I do surgeries and patients sometimes cry for the different reasons. We do the unseen parts, and this other part is the aesthetic part. So it's good to know that the patient will be able to eat comfortably, smile comfortably. It's the best part of our job.
You do single dental implants as well.
After extraction, the dental implants, mostly we do the same time. But if there's an infection or a big kyst, large kyst, so we plan something different. If there's a very large kyst, then first we have to treat the kyst as well. And if we can't do the implant, then the plan changes, like it changed into 3 visits. But it's very rare actually.
The extraction and same day doing implant, here of course we are supporting that. It should be like that because, opening and gum extraction and at least 2 days, the big swell up there, so it's better to do. If the patient won't give us this option, yeah, we are doing. If no, we are waiting 2 months, and after 2 months we are doing implant. Especially we are doing with the mallow bridges. So we are putting implant, same day we are taking impression, in 2 days we are doing the loading and we are putting the temporally, this is very often we are doing this one.
So what dental implant brands?
So we are using different type of the brands. So one of the, for me, is one of the best one is Straumann. Straumann is a Swiss implant coming from Switzerland, which is ICE is the member of the. So for me is very, very important implant, Straumann. Nobel, which is again Swiss implant. Again, we are using Antujur, French one. And Swiss-German mix one is ICX. And Turkish one, Blim.
So do they all come with a lifetime warranty?
When we are doing implant, we are thinking about that this implant is never going to change. Of course, in health, you cannot guarantee anything because your body is not letting us to guarantee something. But when we are doing implant just lifetime. But of course, health, patient health, chronic problems, chronic healthness, or caring is important.
Could you talk about maybe the recovery? So post-dental implants, post-op care, how do you follow up with international patients? And what can the patient do at their end to ensure that their procedure is successful?
After the surgery, actually the pain and the swelling very differs to the patient. But to be honest, I ask all the patients, how was it? How was your day? As far as I know, it's not so terrible. Like you had wisdom teeth extraction. Also, mostly wisdom teeth extracted patients are more unhappy than the implant patients. So implant is not a very hard procedure to handle, I think. And we check the patients the next day. Next day is very important. If everything goes well, if we can see the patients 2 days later, check one more time, or right before they leave.
What about pain?
Pain. All surgery, they have pain. But in surgical stage, when the surgery doing the implant, patient only feel the needle. After needle, all numb, you cannot feel anything. But of course, after surgery, patient have pain, which is we are giving the painkiller. They are taking painkillers and antibiotic as well. After 3 days, patient feel comfortable. But before 3 days, they have inflammation, swallow, and of course they feel a pain. It's impossible say that it's painless. No, it's impossible. Every surgery, if you cut your finger, 1-2 days you feel there when you are touching. Patient feel that as well. But minimize that one, we are giving painkillers.
Is there sedation available as well?
Of course, there is a sedation and general anesthesia as well, which is we are doing them in hospital, and hospital is not far from us, directly there, which is big hospital. We are doing this, and sedation as well. Yeah, we are doing.
Do international patients opt for it? Do they want sedation?
Yes, of course.
They do.
Some patient doesn't want to feel anything. We are doing sedation.
And it's okay to be done in every cases, or are there be?
Of course, the background of the health background is important. We are taking some information, and if the patient can do, then we are doing sedation. If difficult, then we are doing general anesthesia.
Since it's a major surgery, getting dental implants done, are there any risks associated with the surgery itself that an international patient should be prepared for?
Well, as I said, the health doesn't have guarantee. When patient coming to do the implant, of course, some of the risk, for example, diabetic patients, doing the implant is risky. Probably our surgeon already talk about that. Doing implant risky, but depends what the blood sugar, we are checking sugar, and patient looking after very well that they diet, then implant less long. Or some patients have aggressively bone losses. This kind of patient, again, we are checking what level of the bone, and then we are doing implant. And we are supporting that in the patient. We are giving the information that you should take care of your bone, so taking supplements.
Are there any hygiene or any tips that I can, if I've had a dental implant procedure, that I can incorporate to extend the longevity of the procedure?
Firstly, we don't want a patient smoke. Smoking is losing implant. Why? Not directly implant. You lose your bond. And when you lose your bond, automatically around the implant you lose bond as well. So you can lose your implant. Light smoker we can accept.
Of course, it's scientifically known that smoking is bad for oral hygiene and blood vessels in the oral area, so it lowers the healing period. It's not correct to say that if you smoke, you can't have dental implants. We need to see the whole oral situation to decide this.
Of course, cleaning, flossing, brushing. When we are doing the implant and when we are doing the crown, we are giving them all the procedure, how you are going to look after them. The flossing, brushing, maybe a water picks after this mechanical cleaning. Water pick you can use and look after well. If you are going to look after very well, implant is and dental crown is not going to happen anything. All right.
Yeah.
So, good?
Yes.
So, my name is Dr. Medina. I'm prosthodontist. Who is...
Sorry, 1 second. Could you not move?
Okay, sorry. Good?
Take the moment.
Get a great smile with Dentification. Visit a hand-picked dental clinic today.